Hi, my name's Emily Stevens, and this is my Chapter 16 PowerPoint for recruiting and selecting staff. Introduction. According to Sullivan, recruiting and selecting staff who will contribute positively to the organization is crucial in the fast-paced world of healthcare and in the face of an ever-increasing nursing shortage. The direct cost of recruiting, selecting, and training an employee who must later be terminated because of unsatisfactory performance are expensive and include poor quality of work, disruption of morale, patients' ill will, and dissatisfaction, which may contribute to later liability. According to Ola Runtola Coates, the national nursing shortage is longstanding and trending higher as openings have consistently exceeded the ability to hire for decades. Healthcare organizations in the United States are experiencing a persistent shortage of nurses, and the nursing shortage is projected to grow through the next decade. The recruitment and selection process. According to Sullivan, the purpose of recruitment and selection process is to match people to jobs. The purpose of recruitment is to locate and attract enough qualified applicants to provide a pool which the required number of individuals can be selected. When it comes to selecting new staff, this task is usually given to a human resources department. During the recruitment, the nurse manager is the most knowledgeable about the role and the requirements of the nursing position. According to Sullivan, a positive work hospital care environment not only reduced patient mortality, but also improved nurses' perception of the work setting. The best recruitment strategy is the organization's reputation among its nurses. Meaning, if I work at LGH and my friend is a nurse and works at Good Sam, and I talk so highly about how working at LGH is and that I like it and that it's definitely where I want it to be, my friend is more likely to leave Good Sam and come join me because it does have a good reputation. Sullivan also stated that nurses in magnet hospitals demonstrated higher levels of job satisfaction than those in non-magnet hospitals. For example, LGH has received its 5th magnet designation this past year or so. So that speaks volumes compared to a lot of other hospitals locally that have not reached 1 magnet designation, let alone 5. There's only a handful of hospitals throughout the whole country that have reached its 5th designation, like LGH. According to Sullivan, any recruiting strategy includes essentially 4 elements: where to look, how to look, when to look, and how to sell the organization to potential recruits. Each of these elements may be affected by market competition, nursing shortages, reputation, visibility, and location. Many organizations use social media as a recruitment tool. Another key factor is proximity to the home. So a lot of nurses or healthcare staff in general that live around Lancaster County are more likely to choose working at LGH because it's so close to everything and a lot of people that live around here. Another recruitment tool is collaborations with local nursing schools, like for example, PA College. LGH works very closely with PA College, so LGH does receive a number of nursing applicants from the associates program and the 3 and 4-year BSN programs that PA College does offer. Another tool is employing students as aides to allow for another recruitment opportunity. I know that 5 years ago, I started working as a patient care assistant through nursing school because LGH does offer tuition assistance. LGH does also offer a student nurse patient care assistant, so you're not required to work as many hours during a schedule period, but it does help to work in that pool because you kind of go throughout LGH and women's and babies, so you kind of get to see what specialties or what areas that you like that you're more likely to apply to when you do graduate. Posting online, general job search websites, job fairs, and TV access are another way to recruit local applicants. And during extreme shortages, some organizations offer bonuses for staff referrals. I know when I started LGH 5 years ago, the referral bonus that a staff member would get if they referred someone and they were hired and stayed within LGH for at least 6 months, then the bonus was like $1,000. I think now they increased it because we are short staffed through all areas of the hospital. So I believe now it's 2,000. I don't know what the requirements are, but I do know that they have increased it. Careful planning is necessary to ensure that recruitment begins well in advance of anticipated needs. So for me, I graduated May 2020. I started receiving like job fair postcards in the mail around like February, March, so before I even graduated, because I know a lot of my peers were starting to look and apply for jobs around like February, March, because by the time you get the interview, accept the position, and do your NCLEX and all of that, it takes a good couple months. I graduated in May. I didn't start working until the end of August of that same year because of the process of getting everything together. Ola Rontola quotes Diversity in Recruiting and Global Recruiting. This was a study that I looked at. It's about a Massachusetts-based non-for-profit healthcare system called Baystate Health. They, like many hospitals, were facing nursing shortages in their hospitals, clinics, and outpatient facilities. So they partnered with O'Grady Peyton International, which is an international nurse staffing firm, to try to help curb the nursing shortages that were going on. Within this firm, all of the nurses that are recruited have passed the NCLEX just like the rest of us have, are proficient in English, and 75% of the recruits also have their BSN. Some of the countries that Baystate recruited are from India, Nigeria, the Philippines, United Arab Emirates, the United Kingdom, Saudi Arabia, South Africa, Zimbabwe, and Jamaica. Some of the challenges to global recruiting, they were set into two categories: challenges that facing the international nurses themselves, and those facing Baystate Health. So some of the challenges that they identified were completely unfamiliar with the electronic medical record system, lack of familiarity with U.S. population, potential hostility with American employees or patients, resentment from coworkers, communication challenges, and a steep learning curve to culture, patients, team, and organization. Challenges facing Baystate were effective orient and integrate the nurses into the hospital, help the U.S. staff understand the need for the new workers, embrace the enhanced diversity, global knowledge, and additional years of nursing experience that are offered, educate the nursing and medical staff around relevant cultural and healthcare characteristics. To continue on this global recruiting study, with the nurses that are being recruited after they pass the NCLEX, the staffing firm immediately sponsor them, so them and their immediate family can obtain green cards to come here. One positive of the global recruiting is that the nurses that are recruited do receive an hourly wage similar to full-time nurses that work in those hospitals, which I think is a lot better compared to travel nurses who make a large amount of money in a short amount of time compared to nurses that work in those hospitals. An advantage to Baystate Health utilizing international nurses is to increase diversity among hospital staff, which then matches the community that the hospital is serving, which I think is very nice. In conclusion, they sent out a survey to identify some areas of concern to try to alleviate some of that potential challenges, which overall, the program, Baystate and O'Grady Peyton are working on evaluating before and after the introduction of the international nurses. Another study that I looked at looked at the recruitment and retention of community staff, nursing staff, providing a challenge for many healthcare organizations. From this study, it was more of a literature review, but some similarities that were identified were work pressure, working environments, and lack of appreciation by managers. Of these similarities, they were put into two categories: individual factors and organizational factors. Within the individual factors, work pressures were identified between caseload and workload, and an increased work pressure has been correlated to impact patient safety. Poor work-life balance, community nurses found to be dissatisfied with their work-life balance, with challenges in meeting work and family demands. Emotional exhaustion, according to this study, work environment and workload, which will result in perceived time pressure and job burnout, leading to staff turnover due to increased job satisfaction and lack of professional pride. And here are some more organizational factors: salaries and wages. Some nurses said their salary and wage did not reflect the work and responsibilities of their job. I know at LGH, the starting wage between an associate nurses and bachelor degree prepared nurses was very different compared to other local hospitals, especially York Hospital, for example. They are another level 1 trauma center like LGH. Their starting wage was very different than LGH's, so LGH decided that they were going to change it to be more competitive. So now we all have a new starting salary, which is now more competitive with the local facilities in our area. In conclusion, they found that with these areas of concern, it is important to acknowledge those to increase nursing retention especially, and to allow for better recruitment of potential nurses. This is a video of Rebecca Love. She is a nurse, and she talks about the innovation of nurses and how important it is to embrace them in their professional role to allow for retention, recruitment, and just to take better care of our nurses. Because I know with the pandemic and people being burnt out and people just having a very hard time, I think this video is very important for everyone to watch, just to keep that in mind with how nursing is potentially going in the next couple of years. And that's it. Thank you very much.